I congratulate the value program. I think it's really good, and I think that we've had other similar programs in the state with RPAP and MetroPAP before, and value is a whole nother way to do this kind of thing where you get students really involved intimately with the patients in their clinic over a prolonged period of time. And I know as a residency director, I look for students who've done RPAP or who've done MetroPAP because they make much better residents. And that's anecdotal, but there's also data on that, that's out there published too. So.
Hi, I'm Mary Derrick, and I'm a nurse practitioner working for both Health Partners as my clinical practice at the university, teaching the nurse practitioner program. I am working in a really interesting situation right now for Health Partners. We have the geriatrics home visit team, and you were talking about how do we use people in the community, and it's been fascinating to watch this program develop over time. We see patients that are unable to get out of their homes due to either physical illness or mental illness or just not able to negotiate the system anymore because of frailty. And then we come into their homes and make home visits carrying our little bags, just like Dr. Welby used to. Now, you think to yourself, oh, this doesn't really pay off, but honestly, the amount of hospitalizations that this team has been able to avoid for these people that are constantly going in and out of the ER has been amazing. And the collaborative work across departments, across the hospital system, across pharmacy with the medication management team coming into the home and really looking at the situation, PT coming in at my request to go ahead and assess this person for the type of tools they need to stay in their home has been amazing to see. And families are there at every single visit, and they're talking to us. I need this. Can we get a social worker to help me connect with that financial situation because I have no more money and I'm going to run out pretty soon. How can I still stay in my home? Or what do I do if I get sick and I don't want to have that tube down my throat? What can I do to prevent that? But I still want to go to the hospital. And so we have these conversations with people in the community, and I really think that this may be a piece, certainly not the solution, but a piece for some of our frail elderly patients that are not able to quite negotiate the system in the way that those of us that are ambulatory still can.
Can I just dovetail that and the comment you made about the great importance that these value students began to assume for these patients. I actually happen to think that we have a lot of technical challenges facing healthcare. We're going to be under the financial thumb. It's going to be complex. What's going to save the day in the long run are these relationships we develop with patients and these trusting relationships. And one of my favorite stories was, this is a real story, I'm not making this up, was about 5 years ago. It was, I think, our Brookdale clinic. And a guy that was one of these kind of old, quiet, taciturn, never complaining patients was telling his doc about some abdominal pain. And upper GI was ordered. And he went out to the scheduler, the reception scheduler, who called up the GI scheduling office, and we have our usual 7-month wait or something like that. But anyway, was trying to get this person in, and she was given an appointment of about, I don't know, literally a couple months out, and she knew this guy. The scheduler knew this guy, and he'd never ever complained of anything before, had never requested anything. And so she told the other scheduler in GI, she said, that's not good enough. 2 months is not good enough. He's a quiet fellow. I'm really worried about him. And so the GI scheduler trusted her partner and said, okay, I think I can figure out a way to get him in this week. The sad part of the thing is he did turn out to have stomach cancer, but I thought that was a great example of two people maybe not officially on the team in some respects, but definitely part of the team and making a big difference. And that's what I really like about your question, is that there's just a whole lot of people on the team, and we have to remember how important every single one of those people is.